Bismillahirrahmanirrahim. Assalamu alaikum. I'm Dr. Asad Qayyum, presently working as an ENT consultant at Maroof International Hospital, Islamabad, Pakistan. This is my first episode of the series of presentations on various topics in ENT. Today, we will discuss the three different anginas which we come across in our daily ENT practice. I hope this presentation will also be of interest for our colleagues like the dental surgeons, dermatologists, and people from other specialties. I've tried to make it simple without getting into the nitty gritty, especially for the students. In the future lectures, we can discuss every disease in detail. This will be a compare and contrast model highlighting the similarities and the differences between these three diseases on the basis of local lesions, other clinical features, etiology, and management. The red print column on the left side depicts the headings of the similar or the differentiating features. So let's move without wasting time. Now, the heading Anginas in ENT, we are discussing three anginas: Ludwig angina, Vincent's angina, and Herp angina. So one of the main factor to be considered is that whether the disease is life threatening or not. So Ludwig angina is yes, life threatening. The Vincent's angina and Herp angina are not. Herp angina is a self-resolving disease which gets back to normal in a week's time. Age incidence: Ludwig's angina, any age. Vincent angina is more common in children and young adults, and herp angina is most common in the children population. The oral lesions. Basically, Ludwig's angina is considered to be a neck space infection, but it projects itself in the floor of mouth, which is actually the cellulitis. So the lesion main here is cellulitis. In Vincent's angina, there are bleeding ulcers covered by grayish membrane. In herp angina, there are simple ulcers. Coming towards the site, it occupies submandibular and sublingual spaces in case of Ludwig's angina. Gums are mainly involved in Vincent's angina. In herp angina, tonsils are and palate are the main areas which are involved. Now, whether it is unilateral or bilateral, Ludwig angina is always bilateral, though originating from one side, since it spreads through the tissue spaces. So it may arise from one side, it can go to the other side also. Vincent angina is unilateral mainly, and in case of herp angina, it can be either bilateral or unilateral. Lymphadenopathy. It is uncommon due to the direct spread of the disease in the tissue plane, while lymphadenopathy is common both in Vincent angina as well as in case of herp angina. Coming towards the differential diagnosis, in case of Ludwig's angina, we have to differentiate it from angioedema, epiglottitis, and neck space infections. In case of Vincent's angina, we have to rule out follicular tonsillitis, diphtheria, syphilis, and leukemia. In case of herp angina, aphthous ulcers and recurrent oral ulcers come in the differential diagnosis. Coming towards etiology, Ludwig angina is most of the time from the dental source. In case of Vincent's angina, this is because of the poor oral hygiene and poor nutrition. Stress can also give rise to Vincent's angina. In case of herp angina, this is a contagious viral infection. Now, what are the pathogens involved in these three anginas? In case of Ludwig angina, fusiform bacteria, Streptococcus anginosus, and Staph aureus, they are the common organisms. In case of Vincent's angina, similarly, fusiform bacteria is again the causative agent, which is a gram-negative anaerobe. The second most common organism is spirochete. In case of herp angina, the virus responsible for causing this disease entity is Coxsackie virus. Now, coming towards the treatment, the medicinal treatment is common both for Vincent's and Ludwig's angina, in which we give a combination of penicillin and metronidazole. If the isolate is methicillin resistant Staph aureus, then vancomycin is given in addition. Since herpangina is a self-limiting viral disease, so we just need to give symptomatic treatment. In case of Ludwig angina, surgical treatment can be given in terms of incision and drainage, while there is no surgical treatment recommended for Vincent's angina or herp angina. I'll be honored if you have liked my this effort, and if you consider it worth sharing, please do share it with your students and your fellows. Thank you very much for your patient listening. Allah Hafiz.